of MIPS Quality Measure 119, Diabetes Urine Protein Screen for Nephropathy. This is a telehealth eligible measure. The definition is patients 18 to 75 years old with type 1 or type 2 diabetes who had a nephropathy screening test or evidence of nephropathy during the 1-year measurement period. The measure is satisfied by one of the following: a positive or negative result of a micro or macroalbuminuria testing, the patient is prescribed an ACE or an ARB, or documented treatment for pre-existing nephropathy, including being treated for end-stage renal disease, on hemodialysis, chronic renal failure, renal insufficiency, or acute renal failure, or any visit to a nephrologist. The workflow for this measure is as follows. Check and verify the medication list for an ACE or an ARB, if appropriate. Make sure that you've verified the medication list. If the patient has type 2 diabetes and is not on an ACE or an ARB, you will want to order a urine test to check for protein, micro or macro. You can use a protein creatinine ratio, an albumin creatinine ratio, a 24-hour timed or spot urine for albumin, protein, or a total protein. Once this test has been ordered and is received through the EMR, you've met the measure for the year. To exclude a patient for this measure, you can use one of the following. One, documented of treatment for nephropathy. Either the patient is receiving dialysis or being treated for end-stage renal disease, chronic renal failure, acute renal failure, or renal insufficiency. To document this, you will go to the clinical quality flow sheet, to renal disease management. Is patient receiving renal replacement therapy? Opt for yes. And then select the one that is the most appropriate. You can exclude the patient who is in hospice. At the very bottom of the clinical quality flow sheet, under Other, you will see an option for patient received hospice care. And you would select yes. You can exclude patients from this measure for the frailty exclusion codes as well. These exclusion codes are not included in the clinical quality flow sheet. You will have to select them yourself in the visit code. As a review, the definition of the frailty codes are as follows. 1, a patient is 66 years and older and has an institutional special need plan. Or 2, the patient is 66 years and older and has one claim for frailty during the measurement period and is prescribed medication for dementia. Or 3, the patient is 66 years and older with at least one encounter or claim for a frailty code during the measurement period and an encounter for an advanced illness diagnosis during the measurement period. As an example, this patient has type 2 diabetes and we'll say that is not on an ACE or an ARB, but we're going to exclude them from this measure. We would bring in their advanced illness diagnosis, one of the frailty codes that they've been seen for in the past, for example, and down under visit code, where we would otherwise select the encounter type for billing, we're going to have to manually bring in the exclusion code. Under Add CPT, you'll find macro exclusions. Clicking on that will bring up the list of exclusions we have entered into our system, And here we find greater than 65 with frailty and advanced illness diagnosis. We'll select it. We'll link it to the above ICD-10 codes. And once that's been done, we've excluded the patient from the measure. And that covers the diabetic nephropathy screening measure. Thank you very much.